Hi, I'm Kirk with Printed Electronics for the Regular Person. Do you think maybe your circuit could benefit from some new technology? Something that would enable you to print it and maybe even be flexible? This series of videos should give you an idea if it could work for you. This video is intended to give you a quick idea of some of the possible applications in the medical field. And really there's two possibilities. One is medical equipment. The other possibility is monitoring, in particular monitoring of patients. The major development at the moment is really on this one right here. And the reason is, if you think about how you get monitored now, so let's say you've got a blood pressure thing, and you go to see the physician on day one, and here's your blood pressure. And they take a measurement. And then you come back. So let's say you come back in 90 days. And this time, on our little scale here, your blood pressure is right here. So what do they conclude? They conclude that the trend is upward and your blood pressure medicine isn't working. But actually, they have no idea what happened during this period of time right here. It could be that your blood pressure just spiked right up when your mother-in-law came, and then it dropped back down, and then it wandered around, and it kind of is actually headed down right now. So now with printed electronics, the ability is there to monitor in real time, to collect data across this chasm right here. And that should be tremendously valuable. So let me show you a couple of things that are happening now, just to give an idea of what's coming. Now here is a patch that this woman is wearing that is a glucose monitor being developed by the Mayo Clinic and Gentag right now. And when they get this thing working, you'll be able to stick a patch on your skin and tell your blood sugar level. This would be a huge improvement for somebody who's a diabetic or somebody who's obese, where they're pricking their finger all the time, trying to figure out what their blood sugar level is. Here's an interesting couple of ideas. This one right here is from Berkeley, and they announced just over the last couple of months that they've created this printed electronics patch that you put on the skin. This particular one is designed to detect bed sores before they form, before you even can see any visible indication that a bed sore is coming. The way that this one works is they pass a little current through it, and your skin actually changes in resistance a little bit when a bed sore starts to form. They're able to read a voltage out and then determine that a bed sore is just beginning to form. This picture is of vials of blood, but it could just as easily be vials of vaccine or anything else. Right now, what we do with this sort of stuff is we put it in some container and try to keep it at a specific temperature. Typically, we throw a temperature sensor in there and monitor the whole batch. With printed electronics, you'll be able to put a temperature sensor on every one of these very inexpensively and track the temperature on every one. So we'll no longer be wondering if the vials on the outside of the box got a little bit too warm and the ones on the inside of the box stayed a little bit too cold. This is a picture of printed electronics printed directly on the skin. And this technology is just coming in right now. It's not really commercially available like these other ones that I'm showing here. But the future here is to print on the skin, perhaps directly on a wound, and be able to monitor the healing in real time. So if you're thinking, well, what can I do right now? Well, what you can do right now, you can measure pressure, you can measure temperature, you can measure moisture, you can measure movement, you can measure electricity, and you can measure some chemicals. I've spent a lot of time talking about the patient monitoring aspect here, and that's because there's been a lot of advances in that particular area. Sensors are coming up fast in printed electronics, and the reason is there's tremendous value there. You've not been able to measure these things before, or you're flat on your back in the hospital and you have a bunch of wires all over you and they're trying to monitor you in real time. So there's tremendous advantage there. For equipment in medical, there's an awful lot of push-button bezels and flexible displays and that sort of stuff. And all that is headed towards printed electronics as well. There's a quick look at medical, and I hope that you got an idea or two that maybe you can use. Thanks for watching my video. I hope that you learned something that you could really use. This is a very quickly changing technology. If you want to keep up, please subscribe to our channel. There are going to be updates all the time. If you think that this technology might really work for you, then what you need is called an integrator in this world. And here's a list of local integrators that you can contact. Thanks again, and I can't wait to see you again next time.